Good evening, everyone. I welcome all for this today's live webinar on the topic therapeutic option in COVID. So, on behalf of Divine Magic Foundation, I welcome each and every viewer for this interesting and very relevant topic of today's time. We are very privileged to have our experts from the industry today, Dr. Narendra Rungta, who's the chairman, Critical Care Foundation and senior critical care specialist from Jaipur, and Dr. Payal Bhargava, who is co-founder of Divine Magic Foundation and director XPS Analytical Private Limited, Hyderabad. I welcome both sir and ma'am. Before starting the session, I'm privileged to introduce Dr. Payal Bhargava, who has her fellowship in infertility from IMA Hyderabad. She's a life member of IMA Menopause Society and PCOS Society India. She is part of managing committee of PCOS Society India for clinical research and awareness program. She is also co-founder of Divine Magic Foundation, co-founder and director on board XPS Analytical, medical officer at FPA India, and consultant at Sri Krishna Diagnostic Center and visiting consultant at Pradna Hospital, Madhapur, Hyderabad. Thank you so much, ma'am. Welcome both the Dr. Payal Bhargava and our expert, Dr. Narendra Rungta. Ma'am, now I hand over session to Dr. Payal.
Ina, can you just put first slide? So we at Divine Magic Foundation are very happy to invite Dr. Narendra Rungta, sir, an expert in COVID cases. Sir is chairman and managing trustee, Critical Care Foundation, Jaipur. He is past president of Indian Society of Critical Care Medicine. He is founder president, Association of SAARC Countries Critical Care Societies, and past chairman of Intensive Care Chapter. So before we start the session, a few words about Divine Magic Foundation and Critical Care Foundation. Divine Magic Foundation works towards enhancing the profile of women and children by conducting health and awareness camps and educational webinars for doctors. It is now running awareness and educational programs for the public and companies to help individuals prevent, combat, and overcome the COVID infection. It has launched Project Oxygen, an initiative to supplement oxygen support for COVID patients by providing oxygen concentrators and cylinders. So we have Dr. Narendra Rungta from Critical Care Foundation. Sir is going to enlighten us all about the second COVID wave in India. Critical Care Foundation in last 15 months has treated over 15,000 doctors free of cost for management of COVID patients throughout India. About 2,000 plus doctors have been trained in knowledge and skill of critical care on highly subsidized fees on no profit and no loss basis. Many nurses from all over India have been trained under critical care nursing program. Over 25 sessions of public interest have been organized free of cost, mostly concerning to COVID, its implications, management, etc. Lot of flyers have been sent around in the country to educate people at large about COVID. So what is the situation in our country today? Nearly 400,000 cases are reported every day, more than 5,000 deaths reported daily. Onslaught of misinformation and disinformation is being propagated. Media adding fuel to fire, creating fear, anger, and helplessness among our citizens. Rush to get a hospital bed and oxygen therapy. Unscrupulous prescription containing remdesivir, ivermectin, favipiravir, HCQ, azithromycin, and doxycycline. Patients thronging imaging centers and diagnosing labs for HRCT chest and battery of tests even before diagnosis of COVID. hoarding of oxygen and medicines by well-off people adding to menace. So we are here today in the need of correct information about COVID and how to treat the patients during the second wave. So Dr. Rungta sir, will you please enlighten us about CT scan and the battery of lab tests that are being indicated to all patients, and even if not being advised, the patients are running to centers to get the test done.
Thank you, Dr. Payal Bhargava, for inviting me to this very important session today. I also wish to thank Ms. Reena Patil, who is helping out organization of such sessions. Your DivineMagic NGO is also doing a wonderful job of helping out people by organizing these programs and organizing oxygen supply to the needy people in times of distress, and I must congratulate you on that. So I am here and this is a privilege to me. Thank you so much. The question, the very first question, and you have spelled out so many situational issues in your last slide, what is happening around the country. And that's the real problem. And whatever you have said is known to everybody, but what I was fearing that maybe iceberg of the situation, what we are getting know through the media, getting through the government statements, etc., etc. We do not know about what is happening in rural India, and the data from rural, or what we say Bharat, is really very, very difficult to get. Now, the first question is need for CT scan and battery of lab tests, even before a diagnosis is made. Let me clarify very categorically, Dr. Payal, there is no need, let me repeat, there is no need whatsoever for getting a CT scan done or a battery of lab tests. Whenever you suspect COVID in your patient, you just have to monitor oxygen level and get the RT-PCR done. Wait until the report comes. Do nothing. Just isolate yourself, understanding that you are a potentially positive COVID infected patient, and you can spread the infection to your near and dear ones who will come in contact with you. So isolate yourself. And if you go to a city center or a lab for tests, you will only help spread of these infection. Now, the need. Let me further clarify here very clearly and without reservation that neither CT scan or none of the lab tests help us in any manner diagnosing the severity of the disease and possibilities of the prognosis measurement in any patient suffering from COVID. Therefore, CT scan should be done only after the patient is hospitalized and only in few selected patients. The data from the Western countries is their requirement of CT scan chest is less than 3 per 1,000 cases. And in one of the seminars, the colleague was very categorically in saying that he had just got 3 CT scans done in the whole COVID wave. X-ray chest gives you as much information required for diagnosis and helping out the patient for treatment of a COVID patient and making a decision. Therefore, please do not seek a HRCT chest on anybody's advice, or large number of laboratory tests are absolutely useless. Not only you spend a lot of money in getting them done, you will either get infection or give it to someone else if you are infected or you are not infected. Both ways, it is harmful to the society. I hope I've been very, very clear about that. So I will request the audience here to take this message home very, very strongly, that no one suffering from COVID at the initial stages need a CT scan chest or laboratory tests.
Thank you so much, sir. This is the most important question which each and every audience needs to understand, that HRCT chest and the battery of lab tests are not required, especially as soon as or even before a patient is diagnosed of COVID. So my second question is, what is the pre-hospital requirement for patients of COVID?
So, when you say pre-hospital requirement, I would understand that the patient does not need hospitalization at all. That means the patient would be having oxygen saturation of 94 or above.
Yes, sir.
Therefore, the requirements at home are the same for any COVID positive patient. One, isolate yourself, maintain a social distancing from your other household members, but you don't need to close yourself in a room like a prisoner. You can move around keeping a distance, maintaining the standards of sanitization, keeping your crockery a little bit separate, not sharing the dining table, but you can talk to your near and dear ones, watch TV, sanitize everything, wash your hands, wear mask, double mask, and ask your family members to wear mask. But when you are infected and proven by RT-PCR in about 48 hours, when you get the report, it is expected that many members from your family might have been infected as well from the same source which has infected you. Therefore, just closely monitor your relatives in your household. Everybody should wear a mask, sanitize themselves, behave as the potential COVID patients in next 24, 48 or 72 hours. And every patient who is COVID positive should learn how to lie prone, ulta, on your stomach rather than supine, because the lung functions become better, oxygenation becomes better. Keep yourself very well hydrated. Take a lot of liquids, whatever you are used to, except alcohol. Take a lot of water, juices, fresh lime, coconut water, lassi, chach, milk, coffee, tea, whatever you like. But keep yourself very well hydrated. Stay in a cool environment. If you get fever, don't panic. Just take a tablet of paracetamol, and if the fever goes high, say above 101, then it is good to have a quick bath with tap water, not warm water, and allow some time to rinse yourself slowly, and then come back to the cold environment, and then subsequently you may take a tablet of paracetamol. You may or may not take some vitamins, and zinc is harmless. You may take some zinc. They are not costly medicines if you take and one single tablet of vitamin D of 60,000 unit strength. That's it, Payal.
Yes, sir. So coming to the next question, sir, home management of patients.
So in my last answer, I have almost answered the home management of a COVID patient. So if we mean by home management, even those patient hovering between 92 and 94% oxygen, I personally feel that hospital bed stress should be reduced, and patients who are above 92 should also be closely monitored at home. They really do not require oxygen therapy at 92, Between 92 and 94 is a sort of gray zone, but allows you to stay home. I mean, if you lie prone, take a lot of liquids, you do not need any medication at all, other than paracetamol. You may require a cough syrup. The recent data shows that budesonide is a meter dose inhaler that may be inhaled at home, that might stabilize your lung function a little better by bronchodilation. But the dose is little on the higher side, about 800 microgram twice daily. That has been the late suggestion and recommendation. So those patients who are staying back at home and getting home management, in the meanwhile, when they are doing so, they should lie prone, they should take a lot of liquids, paracetamol, some vitamins they may take, and organize some oxygen source. Particularly, I will advise an oxygen concentrator and not an oxygen cylinder, because there may be a mad rush for oxygen cylinder organization and management for household, and we will run short of oxygen cylinders for refilling.
Okay. So, sir, during home management, how many times should a patient take check his oxygen saturation with pulse oximeter, sir?
He can keep it applied to maintain it confidence all the time. If it is fitted into his finger and it is showing 95, 96, the patient will feel very confident. He can smile. And if he sees it 6 hourly, if he is a confident guy, he may do so. But if he's keeping his oxygen saturation above 94 all the time, there is no need to see it so frequently. 6 hourly, 8 hourly, if it is always above 96, 97, and everything is fine, there are no symptoms, there is no problem, there is no breathlessness, patient is not getting tired, he is not very anxious, he can relax, and once in a while note down his oxygen saturation. And these days he can keep a record by taking a picture of pulse oximeter with his camera and store it.
So, sir, as you have suggested that the patients of COVID, they only need dolo and they may use a nebulizer or for their betterment of the lung function. But most of the patients, or almost all patients, it is like some people suggest to give azithromycin or doxycycline. And some of the patients are using both, and they are like, even if we see the patients and we don't prescribe the drugs, they say that no, Dr. Fabiflu is missing, ivermectin is missing. So do we need to give all these medicines as soon as the patient is diagnosed of COVID?
This is a very important question, very good question indeed. I must say very clearly, none of these drugs have found any place for treatment of COVID. They do not help a COVID patient either in curing, reducing the time of suffering or the disease, or reducing symptoms in any manner whatsoever. Therefore, there is no justification for taking any of these drugs, prescription of these drugs, whether it is azithromycin, HCQ, doxycycline, ivermectin, or favipiravir. Yes, all of these drugs have been tried. When a new disease comes, researchers do try every drug they think may help, and all those drugs that we have talked about or you have talked about, they have been tested in various countries, including our own country. And at one time, one or two of them were pronounced to be magic drugs for COVID. None other than by the most powerful person, the President of United States of America. But over a period of time, now it is amply clear that none of these medicines are helpful. One. Number two, when a medicine has effects every medicine will have side effects. Every medicine will have drug interactions. Therefore, don't invite problems, don't invite side effects, don't invite drug interactions. So I will advise the listeners, the audience, to keep away from use of any of these drugs in any manner. I'm not worried who prescribes them, because most of the drugs prescribed by the doctors are on hearsay basis. They should check the facts before prescribing. So I will request the doctors not to prescribe these drugs to COVID patients. Check their facts from the scientific material at the WHO site, CDC site, and of late I have come to know that government of Tamil Nadu have excluded all these drugs from their protocol yesterday evening. Therefore, as the knowledge is pouring on, as the literature and data is pouring on, we are getting more and more wise. Let us take the benefit of this knowledge. Let us take the help of this data and stop using these drugs. Wiser are those who learn from others' experience. If you suffer and subsequently understand something, you are less wise than those who learn from others' mistakes.
Thank you so much, sir. Can you add just a few things about plasma therapy, sir?
Plasma therapy has been a very interesting proposition and research project. It is based on the fact that anybody who has suffered from COVID will develop antibodies against COVID, and if this plasma is transfused into a patient who is suffering from COVID, he will recover. Now, I want to clarify here, it was supposed to be containing antibodies against COVID. Therefore, it will clear the virus, not the disease. Therefore, if there was any use of plasma, it was only to be at the stage when the virus was very active in the upper respiratory airways. Once the virus settles down in lungs and produces the pneumonia that it is known for, the effect of plasma almost becomes negligible. That is number one. Number two, plasma has to be rich in antibodies. So it has to be tested and cleared that this particular sample of plasma is containing antibodies against the S protein, for which the plasma, if given, would be effective in the stage that I have described already in the first 3-4 days, not later than that. The tragedy is, most of the time when the patient does not recover, or in the late stages of the disease, the doctors treating the patient start talking about plasma. They call the relatives and would suggest that please organize plasma. Since the patient is not responding, his oxygen level is going down, he is being put on ventilator, so let's try out plasma. This plasma, and again I must share with you that there are limited number of labs which can measure antibodies level against S protein. Therefore, most of the time we are transfusing untested plasma, assuming that a particular person has suffered from COVID, and we take him granted to have good antibody levels, which usually would not happen. Late transfusion of this plasma is absolute disaster. Why? Because it will produce fluid overload. One, the inundated lungs with pneumonic lesions, if gets lot of water into it because of fluid overload, it will be a tsunami for the lungs and patient will go into severe ARDS. As such, we know by our learning since the era of our MBBS classes. Blood or blood products are the worst medicines. If the patient reacts to them abnormally, it's a very dangerous reaction. And there are lots of reactions. Not only patient would have antibodies against COVID, patient would have lots of antigen also. Patients will have lots of antibodies against other infections also, which are not needed by the patient. Fluid overload is always dangerous. Therefore, I will advise that plasma therapy is absolutely out of any armamentum schedule for COVID management. And where they want to use plasma, they should make a protocol. They should organize a lab which can test the validity of the plasma that they are using. They should select the time period when they want to give it to the patient and record data of every patient, how the patient has responded, if the patient have been helped at all. The current data suggests, the current data worldwide, the meta-analysis for the ordinary layman citizen audience here, let me clarify. Meta-analysis is the analysis of all the studies that has been carried out around the world. Now very clearly shows the mortality has been higher in those patients who received plasma. Mortality is less in those patients who did not receive plasma. Does that clarify the situation that plasma is not recommended? Plasma induces death more than it saves. If I say again, the plasma would not save any patient. In fact, it may kill some. Therefore, plasma therapy is absolutely ruled out.
Thank you so much, sir, because we received so many requests for these plasma therapy from the patients and for donation of plasma from the patients who had become all right of COVID. So thank you so much for this suggestion, sir. It was really very, very needed.
Thank you.
So who are the patients who need hospital admission, sir? COVID patients who need to be hospitalized, who are at home management or otherwise also? Who are the patients who need hospital admission?
So again, see, this is the most important question from the community point of view. From resources, best resource utilization point of view. The hue and cry around the country is about a hospital bed. A country, large country like India, where the population is so large, we have enough number of beds even in the ICU until now, and there never have been hue and cry as we have noticed during last few weeks. Why so? Because everybody who got positive rushed to the hospital and occupied a bed. The hospitals were also accessible and provided bed on first come first service without segregating the patients who really needed a hospital bed from those who did not need it, who did not deserve it. I am sure any patient, COVID positive, would be most happy if he's told in the emergency department that, look, you are fine, you do not need a hospital bed, better go home and look after yourself. But as you have said in the beginning, misinformation, disinformation, rumor mongering, fear mongering, all that has not helped. And there has been a panic button pushed, and people have rushed to the hospital, occupied beds, and even half informed doctors and medical professionals have ended up giving oxygen to these patients, even at a level when oxygen SpO2 was showing 92, 93, 94, and in some cases, I know even when the oxygen level was 96. So those patients who are 92 and above do not need hospital bed at all. They should go home and monitor their oxygen. Many a times this rumor is floated around in the media, on the social media, in group discussions, that oxygen may go down suddenly, vertically, like in a perpendicular shape. That never happens. So I always believe in God. So if the God has to take our lives, that will go anyway. But if you think by going to the hospital at a level of 94, 92 will save us, that is not going to happen. So 92 and above, patient should stay home. But there are certain riders. Patient should not have other severe comorbidities like compromised heart, compromised renal function, or liver function. In those, or severe diabetes, uncontrolled diabetes mellitus. Or there may be one of lots of other diseases exist for which he may be under treatment, like ongoing cancer therapies, etc. So such patients may be kept in hospitals for observation, lest they deteriorate and end up going to the ICU or SDUs. However, all other patients who do not have any comorbidities, as I have described early on, they should stay home. They will be more comfortable, save a lot of money, save a lot of discomfort to themselves and to their family members. Also, only after reaching the hospital and getting admitted, they realize that what kind of stress they are into. Lot of psychological pressures because they are disconnected from their near and dear ones who are not allowed to visit them. They are not sure what medicines are being given because the communication status is very, very low. Even the briefing of the relatives sometimes is missed out. Even some of the relatives are quite wary of reaching out to the hospital professionals to get information. They stay home. So, it's a very tricky situation, and that is why we have seen lots of stress breakdowns in these patients who stay in the hospitals, are still conscious, don't need oxygen, their oxygen level is good, therefore they should stay home. I say, as we progress, as we get lots of more and more oxygen concentrators, as your organization have done by procuring oxygen concentrators, they should seek help from organizations like yours. And oxygen concentrator may go a long way in resolving their problems and help out them in home settings only. They don't need ICU like settings at home. They shouldn't be looking for an oxygen cylinder because that's a very, very difficult proposition to manage. Putting a regulator, putting the catheters, preventing leakage of the hospital. They will just open a cylinder and find that in about an hour the oxygen cylinder has become empty because all the oxygen has leaked because they are not trained in it. So I will suggest, and those whose oxygen level is below 92, they should be hospitalized. And in short, I would say, those who need oxygen therapy, they should be hospitalized. Those who are potential to need hospital therapy, oxygen therapy, are suffering from other serious comorbidities, organ failure, transplant patient, cancer patients, they should be hospitalized, monitored, and if needed, put on oxygen.
Thank you so much, sir. That was a big help. Coming to our next question, what is the demand of oxygen, sir? Why is there so much of demand of oxygen and there's shortage of oxygen in our country? And so many, we see in the newspaper, so many people are dying because of lack of oxygen availability in hospitals.
See, Payal, oxygen is a commodity. It's a medicine. It is produced on commercial basis as it is required in routine. So a production house will produce only that much oxygen which is easily sold out in the market and keep some in storage. Every organization, every hospital has lot of storage facilities for oxygen also. Courtesy rumor mongers, fear mongers, it was very rapidly spread out in social media and newsprint and electronic media that we are running short of oxygen. And overnight, it takes minutes to hours for people to hoard oxygen cylinders. And I fear that more than 1 million cylinders went out of circulation within a period of few hours. Every organization who required oxygen did store some additional cylinders within their capacity to depend on those cylinders in times of gross distress. In case what is going to happen if oxygen is not there and we still have patients on oxygen, they will die and they will be responsible. What if tomorrow oxygen is not there, my own relative, dear and near and dear one, falls very sick and requires oxygen? So, all this leads to a lot of fear and reaction. And we have seen some very, very rich people, powerful people have been involved in selling these oxygen cylinders in black market. You yourself have told me before we started this session how much people have been selling an oxygen cylinder for in your own city. I know what is happening in my city, Jaipur. Therefore, if this happens and the demand for oxygen increase suddenly, the production of oxygen, production ability of our country is not less. We can produce enough oxygen, but oxygen is transported in a particular style, particular manner. Liquid oxygen cannot be transported by air. Gas oxygen can be transported only in cylinders. So we ran out of cylinders. Cylinders were hoarded. And we had limited logistic resources to transport liquid oxygen. Therefore, the tankers, empty tankers were flown by air, by Air Force planes from one city to the city of production and brought back from the city of production to the city of utilization by very fast trains, goods trains. So that's, and this cannot be achieved in a day or two or a week or 10 days. But now that we have about 2 weeks behind us, the oxygen demand in our country has stabilized and supply also has stabilized. In Delhi, there is no hue and cry anymore. In my state, there is some occasional voice that we hear. Bombay is giving oxygen back to other states. Gujarat is surplus. We are hearing some occasional news from Goa, a smaller state. But I, as an ordinary citizen, understand there may be a lot of politics as well, because you can't beat politicians. They will always remain politicians. So come what may, they will play their cards the way they want to. They wouldn't bother how the people are suffering. So that was sudden increase spike in demand, and we cannot meet that out because of logistic reasons, and we did not have enough number of oxygen concentrators in our country, because we have never promoted utilization of these oxygen concentrators in our country except for home care. And those who had oxygen concentrators, they were few in number. They kept those concentrators close to their chest, not telling anyone that they have oxygen concentrators in their household because one or the other reason. And that is how we ran short of oxygen uh, supply, and the demand dominated the picture. It was like, a dam getting broken, dam onslaught, tsunami, and you take some time to recover,
Yes.
clear all the debris. So that's how it has happened about oxygen also. Payal is disconnected. Yeah. You are muted, Payal.
Can you hear me, sir, now?
Yeah, you are muted.
So next question is.
Unmute yourself.
Yeah, unmuted, sir.
Yeah.
Can you hear me, sir, now?
Yes, yes.
So, yes, sir. So it is about the vaccines. The next question. Firstly, there's shortage, and in our state, it hasn't been started yet for 18 plus. The 45 years and above are still waiting for the vaccines. And the other thing is the latest news about Covishield, saying that the duration has the second dose duration has to be taken after 12 weeks. It has created a lot of chaos among people, saying that initially they had taken the earlier ones who had taken in 28 days gap, and then the 6 weeks, and now it has been extended to 12 weeks. So people are worried whether the second dose that they had taken earlier is of any help or not, or will they need another dose also? Should they take the third dose? Like, all these queries are coming from the patients.
While this is $1 billion question, and this must be addressed very, very clearly and shared. The citizens should get a very clear information about. I'm not a government supporter in any manner. Don't take me wrong when I'm saying something. People might say that I'm talking as if I'm a government spokesman. Our population is 135 crores. We have already vaccinated around 18 crores or 18 crores plus in a period of about 2 months. That's not a small number in any manner. That is one of the largest vaccination programs carried out for adults in any country, anytime, given the resources. I remember when I got my first vaccine, I wanted to get it on day one, but my number did not come. I was called to take the first dose after 10 days from the start of vaccination drive. But to my surprise, there were only 3 takers on day 10 at that particular time, and I had to wait for 4 more because the vaccination center told me that we don't want to waste vaccine dose. So there should be a minimum number of 8 patients to receive 8 recipients, prospective recipients for the vaccine dose. There were no queue, there were no demand, and that was only day 10. Therefore, initially when everybody in chair or the health authorities in the country were promoting and requesting people for vaccination, people were just going very, very slow, and questions being were raised. is useless, I will not take this vaccine. And politicians were singing their own songs with their own lyrics and their own music. I'll not talk about that. So the citizens took it easy, and the initial speed was not good enough. Nevertheless, we have achieved 18 crore plus vaccination number. Country like United States, with a population of around 35 crores, they have vaccinated half their population or 60% of their population, which is around 20 crores. So is the number, we cannot vaccinate the whole country at one particular time. In one single day or 3 months, it has to be a long movement. Now that people want to get it, I'm sure the information that I gather from reliable resources, we will have enough number of doses in next few weeks. This week itself, we will have almost 2 crore doses in the coming week. Therefore, people should get their vaccination as early as possible. That is one. Your second question was about the gap between two doses. Let me clarify. I have been a WHO coordinator for vaccination drive when the universal immunization program was launched way back in 1988. Now, the second dose does not ensure the effect of the first dose or boost up the effect of the first dose. The second dose within a small period, when given within a period of 12 weeks or 8 weeks or say now 16 weeks, it is only to cover up the missed out effect of the first dose. The first dose has about 70% seroconversion. When you give the second dose, it produces about 85% seroconversion. When I say seroconversion, that about 15% more people have got successfully vaccinated because it was missed out in them. The first 15% people did not produce enough antibodies, enough immune response. Are you getting me, Payal?
Yes, sir, I can hear you.
No, are you getting? Am I able to explain what I mean?
Yes, sir, I'm understanding it completely.
Right. I hope the audience must also be understanding. Do you want me to clarify it in Hindi also for the benefit of Hindi audience if there are any? Reena?
Yes, sir, please. Yes, sir, please do in Hindi also.
Yes, sir. Yes, sir. In Hindi also.
मैं ये कहना चाहता हूं कि ये जो मल्टीपल डोजेज छोटे छोटे पीरियड्स के अंतराल में दी जाती है, जैसे कि हमारा पोलियो डीपीटी का डोज दिया जाता है बच्चों को, वो इसलिए नहीं दिया जाता है कि पहली डोज को बूस्ट अप करेगी सेकंड डोज को बूस्ट अप करेगी थर्ड डोज. वो इसलिए किया जाता है कि फर्स्ट डोज के बाद काफी लोगों को, काफी बच्चों को उसका इफेक्ट नहीं खड़ा होता, दिखता. पहली बार में करीब 60 से 65% लोगों को इफेक्ट आता है, और जब दूसरी डोज लगा देते हैं तो 20-25% और पेशेंट्स को इसका इफेक्ट आ जाता है. 60% को तो रहता ही है, और 25% यदि तीसरी डोज लगाएंगे तो शायद और 5-7-10% को, 5% को, 6% को ये इसका असर आ जाता है. तो गैप चाहे 4 वीक का हो, चाहे 6 वीक का हो, चाहे 8 वीक का हो, 16 वीक का हो, इससे कोई खास असर नहीं पड़ने वाला है. इसलिए ये वाजिब है कि गैप बहुत कम नहीं रखा जाए. गैप कम से कम 12 हफ्ते का हो तो ठीक रहता है. ठीक है. और क्योंकि इसके अंदर प्रोटीन के खिलाफ ये एस प्रोटीन का बदला हुआ रूप हम लगाते हैं कोविशील्ड के अंदर, देयरफॉर इस टेक्नोलॉजी में गैप थोड़ा ज्यादा रखना ठीक है. That is why it does not make any impact on the outcome or the results of vaccination schedule. So you can take your vaccine after 4 weeks, you can take up your second dose after 16 weeks. It will not harm you in any manner, and because of this delay you really don't have to take a third dose after 12 weeks or 18 weeks, something like that.
Thank you so much, sir. This is the most asked question from my patients. Thank you so much for clarifying it. Coming to the next question, sir, about the post-COVID care. What should we advise our patients? Because some of them, they complain of extreme weakness. There's some breathing difficulty or discomfort they have. And the other most important point is their mental health.
Yes. So the last thing that you have mentioned first, patient COVID की recovery के बाद, particularly those who have come back from hospitals, they are heartbroken. They are mentally broken. They are under tremendous stress. Why? Because they feel that they have escaped death. They have seen deaths while they were in ICU, while they were in hospital. They have seen CPR after CPR going on. Ye gaya, wo gaya. It's like, kite cutting happening during the kite season. Have you heard? In our areas, it is wo kata. The noises that we hear in the skies. So, the score today is, what is today's score? 2, 3, 4, 5, 6 deaths in my ICU. So, the sight of these deaths, sight of misery, sight of the feeling of separation from your near and dear ones, separation from your children, separation from your parents, separation from your mother, father. So that's a nightmare. And we have lots of reports, particularly from Western countries, a lot of people committing suicide while they were under treatment in hospitals. It's a tremendous mental stress. So the worst thing that happens to these patients is mental instability, stress syndromes that they suffer from after coming back to the household from the hospital. That is the foremost. So what they need is support, soft support. They have to be told the worst is over. You have come back. There is nothing else you are going to suffer from. So it will take some time. You don't particularly need any drug support to treat these patients, which may be counterproductive. They just have to be reassured, given some psychotherapy, helped out, light music, early sleep, yoga, hydration, good talking, no negative news, no newspapers, no TV. They are full of negative stories. So this is one of the most important things medical community has to deal with. Number two is, some patients do suffer from fibrosis, lung fibrosis. And to share with our audience what is lung fibrosis is, the lungs are, rubber balloons, elastic, and they imbibe oxygen from the atmosphere by contracting, expanding, contracting, expanding. They lose this ability, this property when fibrosis takes place, and instead of elastic fibers, it becomes a structure of non-elastic, thick, unstretchable fibers. percentage wise. So that doesn't happen in many patients. It is more talked about, but the incidence is not as much. Such patients, couple of patients have been lung transplanted, and many of them are receiving antifibrotic drugs, but none of these helps. And I will advise patients and even my medical colleagues, doctor colleagues, not to rush for lung transplantation, because most of these patients, these data now is coming up, most of these patients, recover sooner than later. And one occasional patient will suffer on long-term basis, not because of COVID alone, but because of other coexisting or previous lung disease like COPD, interstitial lung disease that they have been suffering from, or any other drugs they might have taken before suffering from COVID may harm them. Otherwise, number three, of course, is, as such, fear psychosis prevails amongst the families. So, a social support, a political support, in economic support to these families will go a long way. There has been an occasional report of sudden death in some patients who came back from the hospital. So we have inquiries from a lot of our patients, doctor, do you think we will have the same story as XYZ gentleman expired suddenly even after coming unscathed from the hospital? We tell them, you see, sudden deaths are not rare deaths. They do occur in routine life also, irrespective of COVID. So we should identify, and we are trying to do that, those patients who are more prone to thrombosis. We try to identify them, those patients who have suffered from cardiac ailments, in ischemic heart diseases, heart attacks, they are more prone to thrombosis. थक्के जम जाते, थक्के बन जाते हैं इनके. And once these thakkas or thrombi occupy, the important blood vessels in heart or kidneys or brain, they may suffer from stroke or one of the organ affections. Therefore, उनको एंटी थ्रोम्बोटिक ड्रग्स थोड़ा लंबा दे सकते हैं. And these trials are going on, but nobody is too sure about how things will shape up in future. But yes, there is a room for consideration of anti-thrombotic drugs to be continued for some period in time in these patients. उनको subcutaneously इंजेक्शन भी लग सकते हैं, और आजकल एंटी थ्रोम्बोटिक ओरल ड्रग्स भी बहुत अच्छी आ गई हैं, so they can be given to these patients.
Okay.
Yes, Payal.
Thank you so much, sir. The next question is about mucormycosis, sir. Every day there's an increase in number of cases of mucormycosis.
Yes, mucormycosis.
And a lot of fear among general public.
Yes.
Sir.
You have raised a very good query, Payal, I must say. And mucormycosis is 2 weeks old in the Indian circles. Nobody knew about mucormycosis. Even my doctor colleagues did not know about it before this. Popularly now, for lay media and people, it is known as black fungus. I saw my first case of mucormycosis way back in 1991. In ICU, and suddenly the patient started developing black lesions on tip of the nose and very rapidly spread to the ocular region and then to brain, and the patient had a very, very rapid end. Now, why mucormycosis is happening? Mucormycosis, yes, abnormal number of mucormycosis cases are being reported from our country during last 2 weeks. Gangaram Hospital, Delhi was the first hospital to report about 15-20 cases of mucormycosis, but all of them were reported from wards, not from COVID ICU. Now the cases are being reported from Gujarat, south of India, and other parts of the country, also in my own state as well. Now, what is mucormycosis? ये जानना जरूरी है. This is very important to know. Mucormycosis has always been there. As I told you, I saw my first case in 1991. It's an opportunistic fungus. मौका देखता है अपना, and it attacks it. The spores, इसके spores होते हैं, which are found in common sand, dirty areas, our many places, in the hospital garbage also. So it has always been there, but mucormycosis disease has been rare, very rarely observed. It is not a common infection, but it attacks those. Particularly, it has been, those cases who were reported from Gangaram, they were all diabetics. 100% of them were diabetics. So it thrives on glucose. So those where it gets sugar, ready-made sugar, it thrives there. 2, it thrives in acidic media. Therefore, patients of DKA, diabetic ketoacidosis, they are better hosts of mucormycosis, where mucormycosis will prosper. Immunosuppressed patients will prosper with mucormycosis. Who will become immunosuppressed patients? Who will receive larger doses of steroids, corticosteroids for longer time. Who will receive tocilizumab, more than one dose, or even single dose, or other immunosuppressing agent. Or those who have been taking immunosuppressive drugs for longer time because of one or the other reasons. Third, and which is the most important reason from the current point of view, other than diabetes mellitus, is abuse of antibiotics. If you give them unwanted antibiotics, broad spectrum antibiotics, large number of antibiotics for a good number of days, meropenem, MRSA drugs like teicoplanin, linezolid, polymyxin, we are writing a perfect prescription or invitation to mucormycosis. So abuse of antibiotics in today's times, I would say, other than abuse of steroids in every patient. Now the general practitioner, the doctors, even the patient himself is not hesitant to take steroids because he thinks it's a magic medicine for COVID. But it is very harmful if it is abused. So I would request my doctor colleagues not to use antibiotics at all. In mild, moderate, in home care situations, we do not need any antibiotics to be prescribed for our patients. Even for hospitalized patients, fortunately, I would say, incidence of secondary infection or sepsis reporting has been very, very low from the Western countries, and even in my own experience. Procalcitonin is one investigation which amply would tell us if the patient is suffering from sepsis and needs higher antibiotics or antibiotics at all. But I want to tell my colleagues and you and our audience here that even procalcitonin may rise in the later stages of COVID infection. So we should take help of culture and sensitivity reports, good culture and sensitivity reports, before prescribing antibiotics. I will even adventure to suggest to my audience here that they should ask their doctor twice, request their doctors twice, doctor, do I really need antibiotics? I request my doctor colleagues not to mind this statement of mine. I'm not instigating the audience here, but I'm suggesting that they please check twice with their treating doctors if they really need a doctor. Doctors most of the time would prescribe antibiotics to their patients, fearing that the patient later may question why you did not prescribe antibiotics. Money was not an issue at all. The doctors, in the beginning itself, should clarify to the patients, look, Mr. XYZ, you do not have any evidence of infection at this point in time. So I'm not initiating any antibiotic therapy for you. We will continue to monitor you, wait and watch, and if needed at an appropriate time, if there is an evidence of infection, secondary infection anywhere in the body, we will take up this call and initiate antibiotic therapy. So there is a good evidence to support that yes, we may treat these patients without antibiotic therapy, and if not without antibiotic therapy, at least with poly antibiotic therapy. So these are the reasons for mucormycosis. And mucormycosis, once it happens, mostly it happens in the rhino-ocular and brain areas. It is a very sad thing to happen, very difficult to treat, even if treated very early on. So the best thing is to prevent it. And prevention, as I said, we should not abuse antibiotics, we should not abuse steroids. Diabetes should be controlled. Blood sugar in hospitalized patients should be controlled around to 150. We should not allow any decay, diabetic ketoacidosis, to sustain or supervene in these patients. And the hospital or the doctors and the patient should maintain meticulously all infection control precautions. That again, hand washing, hospital hygiene, disposal of the hospital waste, washing, use of disposable equipment like syringes, masks, gloves. This is very, very important. Not let mucor spores thrive anywhere near you. That will definitely prevent progression of mucor infection in the community, and this will happen. So I'm not very worried about mucormycosis if these observations are remembered and practiced.
Thank you so much, sir, because it is spreading a lot of scare in the public. So coming to my next thing, how one can help society and how we can help each other instead of blaming, the system, the politicians, or the government or others. How I think we should look forward to helping each other in this time of crisis. What do you suggest, sir?
So you are doing a great job on this point, Payal, I must say. I am mainly, performer as a doctor, as a teacher, as a trainer, as a mentor, as a speaker to the society. That's all I'm doing. But you are helping the society in many, many ways, like, providing them oxygen concentrators, organizing these programs for the society. This goes a long way to prevent misinformation, disinformation, rumor mongering, fear mongering, and giving them the correct information is very important. And I will go one step ahead. We can educate our people that every time they are prescribed hospitalization, they should ask, do I really need hospital admission? 2, do I really need oxygen? 3, do I really need remdesivir for? Do I really need, you know, other antibiotics? And last but not the least, do I really need CT scans and these whole gamut of lab tests, which cost so much, which has only helped in spread of the infection? God forbid, after 5 years, we see a very high occurrence reporting of breast cancer in women, because a lot of women have undergone multiple CT scans, and breast is one tissue in human system which is very sensitive to radiation. So I'm little worried about this. All those women who have undergone multiple chest CT scans, they should be monitored. They should self-monitor, and they should go frequent checkups for their breast cancer prevention program, early detection if there is any. So that's how we can help our society. Spreading good news, blocking the bad news, uh, banning the rumor spreaders, disconnecting the social media uh, bad elements coming anywhere close to our groups. So, and but your organization doing a great job. So you can enlighten all of us on this point better than I can do.
Thank you so much, sir. I surely share this recording of this to each and every patient and to my relatives and as many people as possible, because it is such a correct information about because every day when I prescribe and the patient says that you are not giving me enough medicines, there are not many tests you have written. What should I do? When will I become all right? So all these questions, I think it will help me answering. Thank you so much, sir. Would you like to summarize something, sir, about the webinars, today's webinars? Would you like to speak, sir?
I can say Reena has any other questions?
Yes, sir. There are few questions.
Over and above this?
Yeah. Some questions are, where, something which we have, I think, not answered, like very typical questions. I think people are, since, as you rightly said, like people have to, not listen to this gossip mongering about COVID. So there are certain questions which I feel particularly towards children. Like there is Miss Kavita who says that, sir, third wave is approaching, and like there is news that it will impact children more. So what is your take on this?
So, this is the typical rumor mongering. This is the typical fear mongering, which should be blocked and does not deserve any attention whatsoever at this point in time. I know there are very important people talking about this issue, but this issue is not to be talked in public. This is to be talked at the government level, at the top level, and they have to take a call what they should do, what preparation they should undergo, take for the country to prevent third wave at all if it has to come. As far as children, nobody knows what is going to happen. Nobody knew the second wave is coming up. Nobody knew COVID is coming up. You see, so people are speculating more than they understand. So again, this is, I will request all those, even at the very, very high, in very high positions, responsible positions, they should refrain from talking in public about such issues which might send a wave of fear amongst people. Now, children, surely their turn will come for vaccination. And we have always followed the Western countries. We have never, even in COVID, Europe and America were first to suffer. Now, many of these countries also had third wave. They did not have any children suffering from third wave as well. So why should Indian children suffer? So I do not agree with this. Let us see what is going to happen in future after vaccination program is, it goes on for some period in time, and half of our population is inoculated. So I'm not a contributor to this idea, third wave or fourth wave or children affecting. So let's see. We are preparing. The government will prepare. Do its best to prevent such holocaust. So let us not spread this. Let us block such statements where they are. And I will request the common man to ignore such statement. Yes, take precautions at your level. When children's turn come, get them vaccinated. When your turn comes, get yourself vaccinated. Maintain good amount of sanitization. Behave as COVID demands. So this is a new term, COVID behavior. So we need to get used to COVID behavior, and we should not heed such statements. Don't lend your ears or a gray matter to let these ideas settle down in your brain. With folded hand, I also request the authorities in position not to make such wild statements which send fear waves down the spine of our common man.
Very true, sir. Sir, one more question. Sir, is there any special care to be taken post vaccination, especially between the two doses?
No, none. Other than they may have some fever. We have observed those who are taking Covishield, they have more incidence of fever because it's a protein generated vaccine. So take paracetamol, take good hydration amount of liquids, stay in cold environment, don't fiddle with the vaccinated inoculated area, and no special care is needed. Take your bath the next day as usual. So no special precautions are to be taken.
Sir, one more question, though I think you had already addressed this. But there is a question that is there any need to keep these portable oxygen concentrators like Philips available currently at home, especially with elderly family members around?
No, those who can manage it, they may do it. But now that government and responsibly social organizations are organizing these facilities, and we will not run short of oxygen anytime in future. So I don't think needs will arise. But yes, an individual who can afford and organize such facilities, it may not be bad to do so.
Sir, one more question is regarding update of any vaccine for pregnant women.
That will come up. Some of the Western countries have started vaccinating pregnant women. In India also, and the health authorities in the country are right. They should not inoculate pregnant women without good trials. Now that the vaccination program for pregnant women has been started in Western countries, it will very soon come to India also. So let's wait and watch.
Sir, that's it.
So back to Payal.
Yes, so thank you so much, sir, for taking out your precious time for this webinar. It was much needed by everyone. And would you like to say something, sir? Ian?
No, thank you very much. And thanks to you and Reena for organizing this wonderful program. I'm always available to you for such activities. And I wish to thank you, all the audience who have joined us, and also request them to take all this information, and whatever we have talked during last 1 hour or say 70 minutes is all science, pure science, no fiction. There is strong data to suggest and support what we have tried to inform them. So we have not speculated anything. And if anybody has any question, they can send you some questions, information at your email, which you can give to them, and we can answer them with strong supporting data. So thank you very much, everybody. And it has been a wonderful session. I have enjoyed thoroughly, and Payal, you have asked very, very important questions, and some of them will go a long way in mitigating the misunderstandings of common man. And thank you, Reena, for supporting our program.
Thank you. Always a pleasure. Thank you so much, sir.
Thank you so much, Reena. Thank you so much, sir.
Thank you. Thank you. So, bye.